Hello, and welcome to Community Insights. Yes, I am your host for today, Pastor Eve Rogers, with Churches Outreach Network of Pitt and Martin counties. But we are an organization and a group of clergy and spiritual leaders who are concerned about our communities throughout this region and, in fact, throughout this nation. I am so glad to be with you again on this day. We trust that you will have an opportunity to sit and be prepared to just listen to our very special guest on today's program. I am so grateful to have with us Miss Jennifer Johnson. And Jennifer is the Public Information Officer with Pitt County Schools. So all of us in Pitt County especially, but in the surrounding areas as well, may can glean some critical knowledge and information from Jennifer as we talk with her today about one area in particular that the Pitt County Interfaith Clergy is assisting the Pitt County Schools, our Pitt County Public Health Department, and other partners regarding immunizations. And in fact, well, let me say first to you, Jennifer, welcome to Community Insights.
Thank you very much. It's a pleasure to be here.
Thank you, thank you. We will mention now and go into a little detail later about it, but there is a very important community forum that's coming up. On Thursday, is it February the 27th?
Yes, it is.
Concerning immunizations. And so that's what we are going to be talking about today, how this came about and the absolute essentiality of the information for us as parents, as grandparents, as guardians, and just of interested citizens, because I've always been a proponent, Jennifer, that all of the kids in this community are my kids as well as yours and others.
Absolutely.
My husband and I only have one child, one daughter, but I just claimed everybody because we are concerned about our young people, our children, our adolescents, our teenagers, and all of our youth. The first thing I want to talk to you, though, about it, just a couple of questions. Tell us a little bit about your coming to Pitt County or being here and your role and work as a public information officer.
Public Information Officer. This is my second year as Public Information Officer with Pitt County Schools, and before that I was a teacher at South Central High School when South Central High School first opened. I can't believe it's been open for 20 years now.
Wow.
But I began teaching there. My husband is also a teacher and a coach. My students were a complete blessing to me. I've always been in a service career, and so then I became an administrator, worked for a little bit in communications, took a little time away from education, worked in the communications field, and decided to come back as an administrator. And then the public information officer job came open last year, and really felt like with my communications and English background and just really a passion for Pitt County Schools and love of students, we could really tell the story of Pitt County Schools, get the information out there like we are today, and that was very exciting to me. So I'm happy to be here.
Just a wonderful fit and
Yes,
flow
it was a
for
perfect
you.
fit. Yes, it was.
And all of your training, your education, and your experience.
Yes.
Well, I just want to celebrate you and your husband.
Thank you.
Amen, for being teachers, being educators, and just being advocates of students and young people. That is a commendable thing, and I don't take it lightly. You know, sometimes I think, particularly, and I will not say more about that than this, that sometimes our leaders and our governmental authorities and officials, you know, just take teachers and educators for granted.
Right.
But you and I would not be where we are in life today if it weren't for the teachers and the educators and the coaches and so forth that spent time with us educating and directing our life's path.
Absolutely.
So
My
I
husband
celebrate teachers.
Yes. My husband and I are
always
both products of great teachers and great coaches, and we were both teachers and coaches as well.
That is phenomenal. That is phenomenal.
Yes.
Well, concerning the immunization I don't want to say issue, but concerning the program
Yes.
that has recently, I believe it was toward the fall of last year, 2019, that Interfaith Clergy, Pitt County Schools, Pitt County Public Health, and perhaps a few other individual as well as group partners sort of came together and realized that there was a need to address the fact that so many students in our schools here were not properly immunized.
Yes.
Tell me about how that really began and what is the recent history
Absolutely.
of immunizations with students. Is there anything on the books, as we can say, anywhere that says a student must be immunized? What types of immunizations are we talking about, and just how did this whole thrust begin?
Absolutely. Well, immunization is nothing new at all. And as we know, and as we have had children and with our grandchildren, et cetera, we know that children will have well-checked visits and get shots, and we're required to have shots. But where that intersects with the school system is that the school system is actually required by law. Not just the school system, but daycares, anyone that has children around, private schools as well. So we are, by law and general statutes, required. There is an immunization law in North Carolina that we must have parents produce an immunization record for a student. So this is not a new issue at all. And it really is a community not a problem at all, but it is a community effort in that we all need to make sure that we continue to educate ourselves and understand. So what happened in the fall was we realized, even after doing this for years and having processes in place through the school system, that we had several students, actually a high number of students who were coming to school and did not have the immunizations. And to back up a little bit, we get the information out through daycares. Our pediatricians in Pitt County and otherwise are letting the children that they serve know, and parents, and understand. Our health department runs campaigns, et cetera. So we're trying to get the message out. We send letters home on report cards. We let upcoming kindergartner, if someone comes to enroll, and every student has to enroll in kindergarten, if someone comes to enroll in Pitt County schools as a kindergartner, they receive a package of information of all the things that they would need to enroll, and immunization and the lists of that are all indicated in there. But the parent must then take that immunization sheet and make sure that it is produced on the very first day a student. So this is individual students. On the very first day a student is enrolled in a school, they must produce the immunization record. And then, if it is not produced on the first day, there is a 30-day grace period.
Certainly.
So what we have done traditionally in the past is our health department joins with us and maybe provides a free clinic, et cetera. Our social workers at our school are making contact. We're talking with parents. We're sending notes home throughout those 30 days. But by law, at the end of the 30 days, we by law cannot allow a child to attend school at that point. And so that is something that is very difficult. And what happened last fall is we were just very surprised by the number, and the normal means of communication that we had out there were not reaching some of our population. And really, we couldn't put our finger on exactly what part of the population or why or how. It just was an increasing number of students who were not coming to school immunized.
Have you been able, since you began this effort, this initiative in the fall, to sort of determine what was the largest segment of students? Was it the kindergartners? Was it the elementary schools? Was it the middle schools? Did you have some in high schools? What was the largest segment of students seemingly that have just sort of fallen through the cracks a little bit with regards to immunization?
Okay, great question. We have in kindergarten, there are two requirements for students. One is you must have a health assessment. It's called a kindergarten health assessment. And then you must also have immunizations. And then in 7th grade, there are booster immunizations and other immunizations. So while we saw our largest population, probably in kindergarten, We also see in middle school, I think parents forget or it's not on their mind. I believe parents understand that there are immunizations involved for beginning school. Even some of our parents understand that there are more immunizations involved for entering college, but that middle school is a time when kids are more independent. They may not bring some notices home, et cetera. So I think our largest population was in kindergarten, but that is because there are so many.
The onset of the process.
Yes.
That
yes.
goes all the way, I just heard you say,
does.
through to college when
Yes,
we're
it does.
applying, to go to advanced learning
Correct.
institutions. Wow.
Correct.
Yeah.
Correct.
How does the health department connect in a very real way so that parents and guardians can understand that they do have? Because, Jennifer, I would think that there may be many families, parents who do not have private physicians,
Yes.
personal care physicians.
Yes.
So how would you use or connect with or advise parents and families to connect with the health department?
Okay. We worked in tandem with the health department this fall when we noticed a larger number. Now, we do advocate for our parents to visit the health department, and any of these immunizations can be administered at the health department if there's not a private physician available. But this fall, when we noticed the larger number of students that were, out of compliance, I guess is what the law is or says, that our health department said, we will help you. What can we do? So they ordered extra vaccinations. They had 2 walk-in clinics. We advertised that through our social media. Our social workers were calling parents and letting them know. Our social workers even provided transportation to some of these because that is certainly a barrier as well.
It is.
And so really working in tandem with our health department has been very key. And our nurses work with Vidant as well. We have a great relationship with some of our pediatricians. So I felt like this fall we just noticed a problem, but you don't notice it until the student at the very beginning of school. And then you have 30 days. And so when we realized how many students were out of compliance, we really had only 30 days to work through this. And so that's why I'm very excited now that we're partnering with the health department, and it's February. And so we're thinking, why are we getting ready for school and talking about immunizations? That very important reason is because a lot of our pediatricians have backlogs for for appointments and immunizations. So right now is the time to make an appointment.
Absolutely.
Right now is to talk with your healthcare provider. Right now is to make arrangements for, okay, during the summer, I need to put that on the calendar. We need to make sure that we have a well visit, we have our immunizations. And there's a new immunization that's coming up as well for 12th graders. And so this campaign is really going to help us do another service or help us provide a service, which is education to our senior parents. So a student who is entering the 12th grade must also have an immunization. And that law was passed several years ago, and the students who are going to be seniors next year, that affects them and their age group. So we have one more immunization that is required. So now we'll have 3 groups of students entering kindergarten, some of those boosters and vaccinations for 7th grade, and now there is the meningococcal, the meningitis vaccine that is required for 12th grade. And so that's something that we're not used to at the high school level. So we need to educate our parents, and we can't wait until that 30-day grace period.
And
so
you can't wait until August.
That's correct.
When the
That
new
is
school
very
term
correct.
begins
Yes.
Here in Pitt County.
Yes.
But we begin now to give ample opportunity
Yes.
to make appointments, to get into your health care provider,
Yes.
be it the public health department or your private personal physician, or
Right.
wherever you need to go.
And sometimes requesting records takes a little bit of time, so calling
Yes,
your
it does.
doctor and saying, what boosters do I need? And sometimes getting an appointment, asking at that well check. So really it is time to begin thinking about this so that we are all ready, and we can, then there's no disruption in the education of our children at all, and that's what we need.
What is the level of receptivity have you found or seem to be finding? Because this has only been for several months now that
Right.
this push has been on, and it's phenomenal, and I applaud you and all of the partners for this matter. But what has been the level of receptivity from families, from parents? Has there been
Right.
resistance or I didn't know, or thank you so much for prompting me and guiding me through this process? Because for
Right.
everybody, it's not simple.
That's very true. That is very true, and that's one reason we're starting this early. I believe the receptivity is something that we're getting ready to see happen. We are just starting to launch our campaign. In fact, we were doing some photo shoots yesterday, trying to figure out what will speak to parents, what will help them understand. And so we kind of have this tagline of "Are you ready?" And so as parents are getting ready for school, there's a checklist of I need school supplies. I need to make sure I know when that open house is for our schools, and but I also need to make sure my student has immunizations if they are in one of those three groups: the kindergartners, the seventh graders, or the 12th graders. So we want to kind of blend all that information in, and we do believe our parents will be receptive to that. We want to meet them where they are. We listened to our families in August and really tried to understand why they didn't know. And again, many of our families are busy. Many of our families have barriers, transportation, cost. Many of our families are not informed. Some of our families have an incorrect perception of immunization. Some of our families didn't know that they could not send a student to school not immunized, or have ignored things and really didn't think it was a big deal and didn't understand that
Absolutely.
by law a medical suspension can occur, which is certainly not what we want.
And so the hat that you wear just began to get
Yes,
higher and higher
it
and
did.
larger and
It
larger
did.
to get this information
Yes.
and this knowledge out.
Yes.
Yeah, I see that you have something
Yes.
with you here, this board.
do.
Would you just lift that up so that our audience can see that? That is just so neat.
Yes.
I'm a flip chart person,
Oh,
and I
you
like
are?
to
Good.
write things,
Good. I can be in my teacher mode as well, too, so
visual
this
as
is
well
wonderful.
as verbal. Yes,
Yes.
yes.
So we had some of our students out for a photo shoot yesterday for the campaign, but we had them holding signs just saying, "Are you ready? Are you ready for school?" And making sure that immunizations are a part of that. There is a kindergarten health assessment that goes with immunizations, and then just kind of looking like that checklist. We take our pencils and we have our school supplies and we have our open house, and we think of all of those things because those are traditional, but we want to make sure that we understand that. And then most specifically, we want to make sure that parents understand that, and this is very similar, but to be a 12th grader this year, you must have an immunization. So we had some high school students out there. They had a little pink Band-Aid on their arm and just saying, "Hey, have you been immunized?" And using the checklist and the pencils, et cetera. And we have a little logo that says, "Are you ready?" So we really want to make sure that our community is ready, for school. We have a coalition, a group of people, including our clergy and our health department invited, and student services, and any other group that can really help us push the information out there.
Absolutely.
We want to come to the parents. We want to educate them and help them understand. We want to remove those barriers. Like I said, our social workers are fabulous that work within the school. They'll provide transportation. We even have a school or two that has invited physicians to come to the school.
Okay.
And provide clinics at the school site.
That is awesome. That is
So
wonderful.
we'll have so much more information that's coming out. So we want to make sure that everyone is getting ready for school so that we are generally very healthy individuals, which is the reason for immunization, but we're also ready for school, and there are no barriers for being healthy or being educated.
Absolutely, absolutely. Tell us now about the
Okay.
forum that's coming up on Thursday, the 27th of this month, February.
Okay, absolutely. We
And
actually have.
who is invited, who's expected, who can
Okay.
just pour in and just be filled with knowledge and better
Yes,
understanding?
yes. We actually have two events on February 27th. We have a parent meeting that's going to happen in the evening, and that's at our Boys and Girls Club. Any parent that wants to know more information about this is welcome to come to the Boys and Girls Club on Fire Tower Road. It's at 6 p.m. p.m. A lot of parents may be picking up their children, and so we are going to have a panel of guests, and this is just targeted towards our parents and letting them know about the immunizations at all 3 levels. Our Parents for Public Schools, which is a wonderful partner that helps us to educate the community as well as hosting that. We will have representatives from the health department, from our school nursing, which is run through Vidant, Parents for Public Schools and Pitt County Schools, our student services, to really answer some pediatricians as well, to really answer some of those questions about immunizations and what that looks like. So that is really focused for our parents, and that again is at 6 p.m. at the Boys and Girls Club. There's a community
on Thursday,
on
February
Thursday. Yes,
Okay.
February 27th. Thank you. Thank you.
Yes.
Our community forum is earlier that day, and so our
I believe it's 9 a.m.
It
Plan
is.
to be there.
It is. Thank you.
Yes,
Thank you for
yeah,
coming.
yes.
Really, what we are doing is in response to another community forum that happened in the fall, where people came together about this issue, and we really were just saying, why are there so many students that are not immunized? What can we do to remove the barriers? What can we do well? How can we then take this collective effort and move forward? And so during that began the conversation, and then a coalition really began to meet after that and set out really a task list for us and a plan and a timeline to get through the fall so that we are not reaching August this year with the same issue. So that forum will involve our interfaith clergy. The media is invited, parents are invited as well, anyone that would like to come to that. But what we're doing there is really rolling out to our public what our plan is. We will reveal more of our materials, our foundational materials,
Great.
and really reveal more of our plan about how the health department is really connecting with us, when we will have clinics this summer, when we will roll out a social media campaign, and how people can then share and use those materials. We are creating materials so that even churches and other community organizations, pediatricians, business offices can really just have a very small card or a flyer out there with that same message. Are you ready? I want to hear so many people, by the time we come to school, it's, are you ready for school? And but making sure they understand that immunization comes with that. And really having that message repeated. So we're going to really lay out our plan for that forum, in that forum, and really talk about and some of our, I think Senator Don Davis was at the last meeting, and so we really want to make sure that our legislators know, that our community knows, that our media helps push out the story as well, and that Pitt County Schools, in conjunction with our health department and our community, the faith community and other community organizations, really are coming together for our children. That's where I get so excited. It's very exciting to me. We work with educators so many times, but to sit around the table with so many people who are concerned with children and their health.
Multidisciplinary approach.
Yes, and then putting all of our heads together and making sure that the correct message gets out there.
Jennifer, I see it as neighbors helping neighbors.
Yes, absolutely.
Whatever our particular area, if I am just a parent, and you're never just a parent because there's so many elements go into that role and that tremendous responsibility and privilege. But whatever our roles are, our profession or not, then we still come together to help one another because it's all about being healthier, happier, taking advantage of all of the blessed resources that we have in our communities to do that. And so I am just excited, amen, about this initiative.
I get
and
more
this effort.
more excited when I talk about it as well.
I can see that.
Yes.
I can see that. And we are just so fortunate to have you in our community, in our school systems, to help connect the dots for those persons who seem to be extraneous from it. Sometimes we who are right in the midst of it, we get a grip and we can roll pretty effectively and pretty quickly. But to be be able to pull someone else along and in, that they become excited about it
Right.
for their children or for their neighbors' children. Like I said, I don't, my daughter is an adult living out of state,
Right.
but I'm excited about our children, the children that are in our congregations, and just the neighborhood kids, amen, that they will have the ability to take advantage of this information, and
Yes.
it's for their good. There's a scripture in the Bible in Romans chapter 8. Verse 28, and it talks about doing these things for our good and for the glory of God.
Yes.
So I just love that. Is there anything else that you would say to us? We have about 1 minute left.
No, it's just
that you would
absolutely a pleasure to
encourage?
be here. And we really do want our community to rally around the issue and help ask your neighbors, are your children ready? Are you ready? Did you know there was an immunization for 12th grade this year? And help us to get that word out and that message out. But it really does feel like we are all joining hands and we are all really meeting the issues that we have and really on the offensive instead of the defensive this year. So that can't be more exciting to us. And I really think it's
Wonderful.
going to, we're going to see students ready for school.
Yeah,
Ready
I
to be
believe
educated,
so.
ready and healthy, ready for all of the exciting things so that we don't have to, we can remove these barriers, and
Absolutely.
immunization is one of them. So I appreciate you asking us to come here today.
Thank you so much, Jennifer Johnson, who is the Public Information Officer with Pitt County Schools. We are just excited about all of our students, all the way through the 12th grade and beyond, receiving information and being armed with knowledge so that we can be most productive and most happy and successful in our educational pursuit. We will be asking the question continually, are you ready for school? So look forward to hearing more of that. We will have another forum that we may invite you back to here on Community Insights later
Great.
in the spring and even in the summer, so that we can keep this in the minds of our students, but also in the minds of our parents. Thank you so much. And until next time, Pastor Eve Rogers, have a great day.